it's Dr. Mindy here, and I am just thrilled to bring to you a presentation, a topic that is so near and dear to my heart, and that's how the heck do we get people out of pain? Now, I know we've got a ton of different types of practitioners that are all participating in systemic formulas, and we all have different strategies. But I think as you'll see as I go through this presentation, that this is a real crisis in our world today. We have a massive opioid addiction problem. We have more people in pain than ever before. And we as holistic practitioners can truly stand up and make a difference in this arena. So I'm just thrilled to bring this topic to you. And what I'm going to actually do over the next 20, 30 minutes is share with you my family's own personal journey with pain. And I want to share with you protocols that I'm not only using in my practice, but that I have been using it with my own family. So this is really a topic that is near and dear to my heart because of this amazing woman that you see here. These are my parents, and believe it or not, they are in their 80s. And they are very vibrant, healthy. By all means, they are very healthy people. They love life. When they walk into a room, they just light up the room. They're amazing people. And about 6 years ago, my mom started to have hip problems where she was having, that traditional hip pain where it was bone on bone. And we tried everything. We tried chiropractic, we tried massage, we tried muscle balancing. She even went to acupuncture. We threw everything at it. And it wasn't until I actually saw the x-ray where she was bone on bone that we made a decision as a family that surgery may be the only option for her. So she went in and had surgery on her hips and on her first hip. And it was the classic surgery scenario where they told her, go and do this and your life will be totally different. You will be out of pain. Now, if you've ever gone through the surgery experience, the hip replacement surgery experience with anybody, the post-op is atrocious. It is a horrible, painful experience. So after that first surgery, I spent a week at her house just caring for her and trying to help her get out of that incredible pain that she was experiencing from the surgery. And the pain continued, and it wasn't as intense as that first week, but her pain continued for months afterwards. And with the pain came more medication and more medication. And her pain morphed and changed and was different than the pre-op pain, and it was different than the immediate post pain. But the surgery, by all means, was not a cure-all. It wasn't the absolute correction that it had been promised to be. And the other hip started to hurt. So the pain in the other hip really revealed itself. So during this whole time after this initial surgery, she never got off her pain medication. She was on that pain medication consistently every day. So for 2 years, she suffered with pain in the other hip. She was addicted to painkillers. And of course, she would go back to her MD until they recommended she get surgery on the other hip. And so she did. She got surgery on the second hip and came out of that surgery even more in more pain, in more addiction to painkillers, to opioids. It completely changed her personality until I really did not feel like I knew who she was. I didn't feel like I had a relationship with my mom. I didn't feel like I didn't know this person that she was. Now, what I want to point out to you is that this is a woman who raised us holistic. She had supplements at our breakfast table every morning. We were the first kids on the block to go sugar free. She taught me how to read a nutrition label. This was a healthy, natural woman who was now lost in the world of opioid addiction. And it finally got to the point where she landed in the hospital, which a lot of people with opioid addictions have. She landed in the hospital and there was no painkiller that was going to get her out of pain. And she was crying and suffering, and she had run the end of the road. There was nothing she could do. And she was actually suicidal. This was an 80-year-old woman who said, if I have to live like this, this is not how I choose to live, and I need to do something different. So we had a moment where I just sat her down and I said, there are no more surgeries for you. The medical world has no more path for you. Please let me guide you through this. But if I'm going to guide you through it, you have to do it exactly how I'm going to teach it to you. I know probably a lot of you, when you're treating family, is really hard. They don't always listen to you. So I got with people who are addicted to medication, and you'll see all the pieces here that we put together to get her health back. But when people are addicted to opioids, you have to be that firm and that clear with them. Up until that point, I tried a lot of different ways to get through to her, and nothing was working until I showed up in a very big, clear, certain way. I was actually able to move her into the pain-free state that she exists in today. So my first thought to you is I really want you to understand that we can be the solution. We can truly fix this for people. In fact, if we don't show up, who's going to show up for these people? They need to have alternative practitioners, holistic practitioners, whatever we're going to call ourselves. They need to have this type of solution, and it's not going to be as simple. You will see here, it's not as simple as just throwing some muscle rejuvenation at it, although we did use muscle rejuvenation with her, and it worked really well, but we need a multi-therapeutic approach. So I always tell people, strap on a really good tool belt, and you're going to have to use a lot of tools when you're dealing with somebody in chronic pain, because this is something that we can solve, but we're not going to solve it with a chiropractic adjustment. We're not going to solve it with a acupuncture treatment. We're not going to solve it with 1 month of muscle rejuvenation. When they're in this chronic state, we're going to have to bring in a multi-therapeutic approach. So start off with that thinking as I walk you through how do you create a multi-therapeutic approach for a patient. And because this is truly where the magic is when we start looking at addressing root causes for these patients, at creating a different lifestyle for these people to live. So this picture here is actually something I created for my own patients. I realized that what's one of the things that's missing for people who have been chronically ill is that they don't really have a bigger vision for their health other than, I just need to get out of my current crisis. So I really help them understand how they got into the current crisis, but then I also help them see once you're out of the crisis, there's a whole nother world that's waiting for you over here. And I like to call it legacy health. And legacy health, what I explain to patients, is where you're not a burden to your family, either emotionally or financially. You are living life without medication. You're not scared of a diagnosis. You're living such an inspired, healthy life that actually everybody around you wants to participate in your level of lifestyle. They're asking you what to do. If you're a parent, you're modeling it for your children what health looks like. So I mapped out this picture here, and I call it the path to legacy health. And I show my patients that this is where we're going. This is the life we're trying to create for you. But you're going to have to look at two things. You're going to have to look at the root causes that got you out of balance today. And you're going to have to look at customizing. And I say customizing because I think it's so important that people understand there is a personal lifestyle path here, that just because your friend did something doesn't mean that's the lifestyle you're supposed to create. So I really try to empower people to customize a lifestyle. What I see in my online world, in my Resetter tribe, on my YouTube channel, in all the comments that people are making, is that people are looking for that one answer. They want the one trick pony. They want, when they decide to come from the conventional world over here to the alternative world, they're looking for the one thing, the one diagnosis, the one pill. And what the legacy health example really gives them is an understanding that you're going to have to change your lifestyle, and you're going to have to address these root causes. You've got to get down into the nitty gritty of why the body got out of balance. And then we're going to rebuild you a lifestyle that is going to give you insane health. But it's not going to be, again, about throwing one supplement at you or one diet, and that's not going to be the cure-all. So let's go and start with what is the root cause of pain. So now that you understand the mentality in which I come from and the way I teach my patients, here's what I'm seeing in my clinic, and this was definitely the case with my mom, is what is causing pain to not go away. Now, I know I'm preaching to the choir. I know that what bonds us as holistic practitioners is that we truly believe the body can heal itself. And I love that about how we look at healing. I know we all have incredible faith in the body. But if you just look at what pain is a signal something's out of balance. So let's use chiropractic as an example. That's my background. For many years, I would just adjust people and they would get out of pain. I've been in practice 23 years. That was my go-to. I would adjust, they would get out of pain. Some people it would take 3 visits, some people it would take 20 visits, but eventually everybody got out of pain. So it was a very structural, mechanistic way of looking at pain. Now, fast forward to today's world, where we are living right now in this world. Now, I don't know about you, but I know in my clinic, for many of my patients, it's no longer enough to just adjust them and they'll be out of pain. We have to look at, why is the nervous system overloaded? Why is it bad? What's going on in the gut? And what's happening with their toxic load? So those are the 3 major questions that I ask myself. And again, when I go to educate a patient, this is what I tell them, is this is what we're going to look at. Why is your nervous system giving you these pain signals? What is your gut doing that's causing chronic inflammation? And could it be that your toxic bucket is so full that your healing response is muted, that your body is unable to handle the barrage of toxins? So these are the 3 pieces that we put together in a puzzle when we go to work with people with pain. And I'm going to show you exactly what we did with my mom, because these were the exact 3 things that we did. So let's start with your nervous system overloaded. And I think I've used a lot of different terminology with patients on this, that you want to use verbiage that is going to connect with their pain point. And what I'm finding is that when I say to people, you're stuck in sympathetic dominance, some people don't really know what that means. When I say your brain is stuck in fight or flight and you're not able to come out of it, then I get a little more of a, yeah, that's how I feel. when I actually verbalize that your nervous system is overloaded, and it's overloaded because of your rushing lifestyle. It's overloaded because your spine is decaying. It's overloaded because of your horrible eating. Whatever your path to this nervous system overload, when I come in with that verbiage, you just see the light bulbs go off in people's brain. And you can see them shake their head. You can see them go, yes, that's how I feel. This actual term, your nervous system is overloaded, was the door in with my mom. When she hit that point in the emergency room where she was crying, saying she didn't want to live anymore, I looked her in the eye and I just said, I totally get it. And your nervous system cannot handle this level of stress anymore. You have been under chronic pain for over 5 years. Your nervous system is overloaded. And honestly, the minute I said that, she just started crying. And it was like, okay, now we can start to have a better conversation. Now we can look at not just masking the nervous system, we can look at how do we pull the nervous system out of this overload. And you'll see as I show you my multi-therapeutic approach to this, there are a lot of different ways. Now, back up one step, go watch the webinar I did on calming your brain, because one of the things we know about sympathetic dominance is that when you're under so much stress, when stress is just coming at you from all angles, what happens is those paraspinal muscles just lock down. Your jaw locks down. Your body is in a constant state of contraction. So now, as a chiropractor, if you go to try to adjust that, or as a massage therapist, whatever your protocols are, you try to work with that. The body is like this, and it cannot click out of that. You have to come in like the side door and work on a way to tell the brain it doesn't need to be in sympathetic dominance. And I did a whole webinar on that, called Calming Your Brain, and it's all about getting your patients out of sympathetic dominance. But understand that's the place they're coming from. That is where they are at. Then the second thing we have is that classic pinched nerve, and if in the situation with my mom, in the situation that I see with a lot of my patients, it's not always pinched nerve is like old school. That's sort of the way we used to look at pain. There's too many things attacking the body now for it to be as simple as a pinched nerve. And in the chronic pain world, it's not as simple as a pinched nerve. You could have multiple nerves that are irritated, but know that there can be a pinched nerve, but it's not only a pinched nerve. And then the third thing we look at are muscular and skeletal imbalances. So with my mom, we really had to look. She had a scoliosis. She walked in a very interesting way because she was overusing some muscles and underusing some others. So in the nervous system overloaded body, there still is a structural issue that needs to be addressed. And there is a brain issue that really needs to be addressed. So with that in mind, what I want to show you is, and what again, I know I'm like such a preacher and fan of systemic, but they have given me a tool bag that I can address all of the structural problems, and I can address this nervous system overload. So let me start with this one on the bottom here, HQ and end nerve. So HQ and end nerve, if you have not used this with your patients, I cannot tell you how amazing this combination of supplements can be. So that combination is specifically designed to help strengthen the parasympathetic nervous system. So people who are sympathetic dominant, what's happening is they've overused the sympathetic nervous system and they're not using their parasympathetic nervous system. Now, having said that, as somebody who is an overuser of my sympathetic nervous system, it's hard for a sympathetic dominant person to just sit in a chair and meditate. It's hard for this person who's stuck in that sympathetic state to slow down. It's like we know logically we're supposed to do that, but it's very difficult to do. So what systemic has given us as a gift in HQ&N nerve is that it starts to give your vagus nerve specifically, but also it starts to get nutrition to the parasympathetic nervous system. And I have seen it work with patients. I know many of the fellow practitioners here at Systemic that I talk with have had amazing results with HQ&N nerve. What my personal experience has been, I shared this in Calming Your Brain webinar. I went on vacation last summer with my older sister, and I wanted to go into the vacation very relaxed. And so I'm like, okay, well, let me test HQ&N nerve. Let me see how that combination works for me. And it was amazing. I mean, where we would typically on a vacation have sisterly fights, she would get herself really agitated about something, and I felt so calm and so mellow. She would want to come over and try to pick a fight with me, and I was just not reacting. And that is something that's just completely new to me. So really, when we look at the nervous system overload issue with chronic pain, please use HQ&N nerve as an incredible resource that you may have to keep your patients on that are so stuck in that state. You may have to keep them on that for 6 months at a time. And you'll never hear me say that with Systemic's formulas. I always cycle, but this particular one for that stuck sympathetic dominance person can be really helpful. The other set of supplements that I have used with people in chronic pain, and it also works incredibly well with people who have like a disc herniation or people who are having like an acute pain situation, is JOT, Kyro, and ARTA. So I started using this before the muscle rejuvenation kit came out. And it was really interesting because I had just started using it. And then I went to a Systemic seminar, and Dr. Shane got up there and talked about this new great system, the muscle rejuvenation, and it has JOT, Kyro, and ARTA in it. And it was really exciting because I always think that having little packets is really helpful. But with somebody that's in intense pain, I mega dose JOT, Kyro, and ARTA. So I have them do 2 of each 3 times a day. So they're doing 6 total, and I have them do it for 2 weeks. And the reason is I tell them that this is your natural Advil. This is your natural painkiller. What these supplements are going to do is they're going to bring that inflammation down, and they're going to start to get nutrients to the joints and to the muscles, and they're going to start to create some repair. So they're better than an Advil because they're therapeutic and they're repairing as well as killing the pain. This has been amazing for those flare-ups. And if you haven't put those 3 together in that dose, I believe that the dose is really important. In fact, I can tell you with using Systemic's formulas for several years now, the dose can be really important. If you go and you give a set of supplements to a patient and they're not improving, there's a very good chance you need to double that dose. These products are food-based, they're herb-based, they have bioenergetics in them. If you're not familiar with the idiosyncrasies of these products, you absolutely have to get to one of the seminars so you can understand how thorough and how well made these products are. And then that sort of gives you an idea of how you should be using the products with your patients. But JOT, Kyro, and ARTA at high mega doses is fabulous for pain. The other 2 that we use, and you'll see how I use it in this multi-therapeutic approach, is I do use the muscle rejuvenation pack. I have used that when I do a lot of corrective chiropractic. So if I look at somebody's x-rays and I see that their muscles or their ligaments are really rigid and I know they're dehydrated, well, if I go in there and try to make some curve change in their neck and there's not enough nutrients to those ligaments, that's going to be pretty tough. So I've used the muscle rejuvenation packets for that. In fact, we love muscle rejuvenation so much that we have actually put it into a home care system. So our patients get home care to work on to help with their spine. And a part of that home care is the muscle rejuvenation packet so that they're getting the nutrition back to these joints. Now, in my mom's situation, you'll see where I put it in. I actually put it in at the end of her protocol because I wanted to address some of the more inflammatory pieces of her condition. But over time, it's the muscle rejuvenation packets that are going to really help with preventing any further arthritis and are going to help me at the adjusting table. And then, of course, the collagen powder is fabulous. So we use that a lot, especially with the elderly. The only trick I found with the collagen powder is, you'll see here in a second, we're big on fasting, and I want to make sure that people use the collagen outside of their fasting window. So, but here alone, in all levels of health or of pain, you have in just these 4 protocols I just gave you, you have an amazing opportunity to get somebody out of pain that will go along with what you're already using. So it's, I've said this on other webinars. I don't want patients to think the pill healed them, because if they think the pill that you gave them healed them, then they're just applying the same healthcare paradigm that they applied with their medical doctor. They're just applying that same paradigm to me. And that's not what I want them to know. I want them to know that their body is so powerful. So these 4 that I have right here shows you that you can use those in combination with with whatever you're doing, massage therapist, chiropractor, acupuncturist, whatever your other tool is, these 4 will fit really nicely into there. Okay, so that's nervous system. Now let's go on to gut imbalances. So if you go back and if you've ever read my book, The Reset Factor, it was really about fixing your health by fixing your gut. And what we know about the gut is that it's under more toxic barrage than ever before. We know that this antibiotic-rich world that we live in is destroying people's guts. And what we're seeing in my clinic a lot is that it's causing a chronic inflammatory condition. So let's start off with just leaky gut for a moment. If you look at what a leaky gut situation is you've got holes inside the gut, little tiny pinholes that are allowing in undigested food, and they're allowing toxins to go into the bloodstream. And they go into the bloodstream, and the person's immune system decides that that's a foreign invader, that shouldn't be there, and it will attack it by raising the inflammatory response. So fixing the leaky gut, and I'll show you here in a moment how some of the tools Systemic has given us for this, is almost like the most important step when you're dealing with a chronic pain person. Now, and I think most everybody's walking around with a leaky gut. If you just dive into glyphosate and you just look at what glyphosate's doing to the gut, anytime you eat out, you're having a glyphosate exposure that is damaging the protective bacteria in the gut. And when that protective bacteria get damaged, then the mucosal lining can start to get the tight junctions that are holding it together become weak, and the food can go in. So that's how I look at leaky gut. Now, we have another scenario that you'll find in patients. And I know, again, we've got practitioners that muscle test, and we've got practitioners that do a lot of different strategies to figure out what's going on in the gut. The biggest things that I see with chronic pain are Candida and parasites. And this is what my mom had. She had Candida. She's had it her whole life. She knew she had Candida. Candida is not one of those things that ever goes away. You just bat it down. You just decrease it. So what you'll see in the protocol that I used with her, you have to address the Candida. It has to be addressed as well. I have seen parasites cause chronic pain. So I like to use Vibrant Wellness is the company that I use. And I use, it's a stool test, and it's called a gut zoomer. And it will tell me if they have Candida, if they have parasite, virus, E. coli, which on another webinar, I'll teach you how E. coli, the phage therapy that systemic does, is amazing for helping kill down E. coli. But it also will tell me, Gut Zoomer will tell me if they have the good protective bacteria. Because if they're missing the good protective bacteria, then that's also contributing to a leaky gut. So whether you decide to muscle test, whether you want to do an actual test, I know the OAT test will tell Candida and some other things. So there are a lot of good tests out there. This is just the one that I like to use because it's so definitive. These are the three things we see in the gut that really affect chronic pain. And thank you to Systemic for giving me a heck of a toolbox to go after these. So here are the protocols that I've used for Candida, I've used for parasites, and I've used for a leaky gut. Let's start with Candida, because there was a time in my practice where I saw that every chronic pain, low back specifically, patient that I had a Candida of some kind. There seemed to be a very one-to-one relationship there. So I use a 60-day protocol for Candida. The first month, I'll have them do Tyrochi and Katsakonic. Both of those are in liquid form. They don't always taste great, but it's a good way to kind of titrate up the Candida killing. I love that Systemic has liquids for us, because wherever we have liquids, we can be slow in how we go after the problem. I had a patient who had some chronic musculoskeletal issues. She had Candida. She was a competitive athlete, and we put her on the second protocol that you see here, the Fung DX, the VIVI, and the Attack. And she started to have such a bad die-off with Candida that she was like an emotional wreck. So we switched her over to Tyrochi and Katsakonic, and I found that I could titrate it, and it was much better. So those are the 2 months that I do. First month with the liquids. Second month, I do Fung DX, VIVI, and Attack. Now, if after 60 days you feel like they still have some Candida, couple tricks to know they would still have Candida is ask them to look at their tongue. What color is their tongue? Is it turning white? Is it yellow? A white, yellow, black tongue will, as Candida dies off, will show you if the presence of Candida is still there. You want to see it turn to a pink tongue. When it turns to a pink tongue, when you use these killers, you know that you've killed down Candida. So if you get to the end of 6 months and their tongue is still white, primarily in the morning, then I would cycle back to month 1 again. And then I would go to month 2 and I would cycle back until you see a change in the tongue. Brain fog is Candida. Ringing in the ears can still be Candida. So if those three, and cravings, carbohydrate cravings, sugar cravings, if those 4 symptoms are still there, you want to just keep cycling the Candida protocols. The second one that we use is parasites. Now, when you go to kill parasites, it is very important that you cycle. In fact, I would just take a picture of this screen so you understand the correct protocol for parasite killing. This is exactly how we do it. VRM 1 and 2, we use C. colon so that we can make sure the person's having a bowel movement and getting those parasites out of them. We use SENG to open up the lymph and make sure that it's not staying as the die-off of the parasite is happening, to make sure it doesn't stay stagnant in the body. And then we use bind to make sure that we bind to it, any die-off, so that it can get out the colon. And we do that for a short period of time. The parasites are not something that you just put somebody on the VRMs and you leave them on there for months. You actually want to use them in a very cyclical way. So you do 10 days on, and then you're going to do 5 days off, meaning you're not using the VRMs, you're not killing the parasites, you're just using the binders, you're just keeping the colon and the lymph open. Then you're going to go 10 days on with the VRM 3 and 4, along with SENG and bind. And there's a typo there. You can still use C. colon. And then you're going to go off for 5 days. So this is the exact protocol that we use. With my parasite patients, I find they have a lot of joint pain. So they're the ones that have more of the chronic pain, maybe in the hands, the knees, the shoulders, the ankles. There's just a lot more joint pain. So that's kind of the difference that I see. Whereas with Candida, I tend to see them have more spinal pain, especially low back. This was my mom. She had spinal pain, neck pain for a while, but then it had eventually turned to her low back. On a side note, this is totally random off to the side with this parasite cleanse. We have used these, and Systemic needs to do a webinar on this. We've used these with my dog. So we've used parasite cleansing with my dog for who has had like an itchiness, like a skin condition, and it has worked incredibly well. So this parasite protocol I just gave you is magic, and it can work on a variety of conditions. Then the last thing we look at is leaky gut. Now, let me tell you about leaky gut, because I think there's some interesting things that happen with patients who have a leaky gut. These are the people that when you massage them or you adjust them, they get sore immediately. Like they have a reaction immediately. So L-Gut was made specifically for leaky gut. I put my patients, if within the first couple of adjustments, they're having a really tough, sore reaction to the adjustment, then I put them on L-Gut to seal off any of the junctions that have been open, allowing a chronic inflammatory situation. I also will cycle through the different enzymes. The enzymes are great for breaking down food when people are eating their food. It'll help them break it down so that when it gets to the gut, it's already pre-digested. It's not going to get into those junctions that have been open. And I cycle through all the enzymes. I go back and forth. Like Z-gluten is great because most of the chronic pain people have some kind of Z-gluten issue or a gluten issue. But I love all of them. So just you can cycle through those. If you think they've had some long-standing issues with chronic pain, there are two places that you would take enzymes. One is you would take it with a meal to help break down food, like I just explained. The second place you would have them take it is actually in between meals. So I know in my protocols, when I take an x-ray on somebody, I look on those side walls, or I can see on a lateral x-ray of the low back that there is like a speckled appearance where you can see that there is stools that have been stuck on the side walls of the intestines. So I actually will give them enzymes in between their meals to break down anything that's stuck on those side walls. Think of the intestinal mucosa as like this living, breathing amoeba. It needs to filter so that toxins don't get into the bloodstream, but nutrients can from your food. And if somebody's had a long-standing gut issue, it's like there's this caked, like undigested food that can live on that lining of the wall. And so they're not absorbing their nutrients. It's fermenting there, causing candida, and it's causing a chronic inflammatory situation. So these enzymes become imperative, because if you give somebody enzymes in between their meals, it's going to break that stuff down. It will go into this caked on food, and it'll actually start to break it down. So that has been life-changing for a lot of my patients. They will tell me they notice that they're not bloated anymore. They'll tell me that they are feeling like the pain actually starts to go away with the enzyme. So that's a little trick there. With the person in chronic pain, please don't forget the gut. Please don't forget the gut, because we have some great tools with the muscle rejuvenation and the Kyro, ARTA. Those are great for specifically spinal issues. But if you've got an imbalance in the gut, you've got a chronic inflammatory condition, and you'll never completely get someone out of pain until you address this. So these are the big protocols that I use for the gut. So let's go back. There's a nervous system overload, there's a gut imbalance, and now I want to move on to a toxic overload. That there is a lot of your patients that you're dealing with, their toxic bucket is just completely full to the top. And so you want to educate the patient on the toxic overload. You want to let them know that their bucket may be filling all the way to the top. And there are ways, I look at it, like if you look at this next slide here and you look at the bucket, you'll see that there are ways that the symptoms, very specific symptoms that are showing up that give us an indication that the toxic bucket is completely full. So, for example, they have trouble sleeping. They are anxious and depressed all the time. That chronic pain is one of them. They have trouble losing weight. They have brain fog. Some paranoia can show up. Visual changes in their eyes. So either dramatic changes in the eyes, or they have a lot of cataracts, macular degeneration. So those are signs outside of a chronic pain that would tell me, hey, you know what? Your toxic bucket is really full. And, you have to, this is one of those topics that I think is hard for patients to grasp. They understand we live, or they're just starting to understand we live in a toxic world, and because an overflowing toxic bucket may look different for you than it does for me, it can be kind of this mysterious place. So we use a neurotoxic questionnaire in our office where I kind of give people a reference that they're looking at. There's the Medioxy test that Systemic has that will tell cellular inflammation. So that's an awesome test, because I can use that. And if somebody's eating really well, I can say, well, you still have cellular inflammation. So there's another source of irritation here. So you may have to do a little more explanation of how toxins will affect pain. There's great articles on PubMed. If you search heavy metals and pain, you'll see that lead lives in the skeletal bones, and it has a half-life of 20 years. So it takes 20 years from the exposure for the lead to even start to break down and come out of those bones. So what we're seeing is a lot of these people who are in their 40s and 50s and even into the 60s, like that's where the pain is showing up, because they've been walking around on these skeletal bones that are packed with lead. And as the lead comes out, it can create a pain response. So there's great research on there. I would highly recommend you go to PubMed and you do some research on it. Lead can wear away disc spaces. Anybody that we come up against a hurdle with any kind of chronic pain situation, we will use the next thing that I'll show you here, which is my absolute favorite. I know I have a lot of favorites at Systemic, but this one is one of my absolute, which is Prep Body and Brain. This is their cellular detox that they use. So I will put people through TCD. I'll put them through that process of getting heavy metals out of the body. So if you're not familiar with that, I'm sure there's other webinars that have been done on it. I also would recommend you come to the seminars, because this is where you learn the magic of Systemic and all the cool tools they have. So most every one of my chronic pain patients will go on Prep Body and Brain. We also put them, and I realize I got a typo here, we also will put them sometimes on IBS, which is the initial form. I call it my beginner's detox. It's basically G-cell and bind. So if you're not really sure how to detox somebody, you think their chronic pain patient has a toxic issue, you're not really ready to drop into Prep Body and Brain, then IBS is great. And they take 2 G-cell in the morning and 2 bind at night. It's a real good initial way to go after toxins. But what we do in our office is we're very focused on detox as a major component of everybody's healing plan. And so the Prep Body and Brain gives us the best tools that we have ever seen for pulling out heavy metals, for getting mold out, BPA, glyphosate, all of that. This is really a way for us to start to work on minimizing their toxic load. So I think it's really common with neurotoxic symptoms for us to think that they're more hormonal, they're more in the brain, they have more to do with sleep. And we forget that the chronic pain patient may be in chronic pain because of a toxic overload. So understand, I think that's a really key piece. So that's toxins. That's how we deal with toxins. And then I want to dive into lifestyle. So once you've addressed, thinking in your own doctor brain of, okay, what's the root cause here that I'm dealing with? Am I dealing with a nervous system overload? Am I dealing with a gut imbalance? Or am I dealing with toxic overload? That's like the first 3 questions I ask myself in like the consult. That's like something I'm evaluating from day one. What are the root causes that I'm dealing with? Then you want to come over here to lifestyle and ask yourself, what is the lifestyle that this person needs? And I think we live in a really interesting time where people are more aware that they need to customize their lifestyle than ever before. That people are waking up to the fact that there's not just one way to do a healthy lifestyle. So I like to break it down for them in like 3 areas. I like to look at their diet, and I'll show you how I did it here in a moment. I like to look at, are they fasting? So if you're not familiar with fasting, please go educate yourself, because I have seen so many people lower their chronic pain issues down with fasting. And sometimes I find people are really resistant to change their diet. But if I ask them to intermittent fast, they're like, okay, I'll try that. Let me see if that will help me. So, and if they just get a glimmer of what fasting can do for them, meaning all of a sudden their pain goes away, just even for a couple of hours, now you have them. Now they're willing to fast with you as much as possible. If you're not experienced with fasting, go check out my YouTube channel. I have done a ton of videos on all different types of fasting. So in this day and age, you really need to educate yourself on what fasting is and how to use it in a multi-therapeutic approach. And then the third thing that I look at is, how are they exercising? In the person who has got a nervous system overload, they actually need to exercise less. In the person that has a muscular imbalance, they actually need to do a different exercise. In the person that is in chronic pain because they don't exercise, they have no muscle structure, they need to exercise. So movement can lower inflammation. Movement can stimulate BDNF in the brain, which is like fertilizer for the brain, and help with happiness. So we really want to get these people moving. So these are the three major components that I look at when I go to put a lifestyle together. So, okay, having said all of that, now how the heck do you put all these pieces together? So I'm going to walk you through the multi-therapeutic approach I used with my mom. There's two ways you can work with this. You can decide, hey, I love that approach. I'm going to give you 3 months worth. So you can just say, I'm going to try that as a 90-day approach for your patients. I encourage you to do that. If you see me at a seminar, come chat with me and let me know how that worked. Some of you might look at my multi-therapeutic approach and go, well, I want to change a few pieces out. Have the flexibility to do that. That is really what this webinar is about, is showing you how I put all the tools together, and you may have a different slant on that. So please use the freedom to switch things out as you feel necessary. So, but remember that you can't create optimum health if you haven't addressed these root causes. So figure out which root causes are at play here. And I tell my patients when I meet with them and I make my recommendations, I say, I think you have a nervous system that's overloaded. I think your gut is massively out of balance. And I know that your toxic bucket is overflowing. So we need to spend the next 9 to 12 months together addressing these root causes before I can even really get a lifestyle to work for you. So it gives context for patients. It gives them an understanding of the severity of this situation. It wakes them up a little bit. It gets them out of that paradigm of, I've got to just do one thing to get my pain under control. It gives them a different paradigm to enter into. Then also understand that you are going to be helping them build a lifestyle. And what has blown me away, probably more than anything with working with these patients, is that there's a lot of what would look like healthy patients, people that are living a healthy lifestyle, that are still creating, their lifestyle is still creating an inflammatory response. My mom is a perfect example. This woman has been gluten-free for like 40 years, like before even people even realized that gluten was an issue. So when I sat down with her and talked to her about going grain-free, she was actually really surprised. She looked at me and was like, well, I'm gluten-free. Isn't that enough? And I was like, no, you need to go grain-free. We need to get you off fruits. We need to get you off sugars. You'll see in her a moment. I put her on a very traditional keto diet for a short period of time. And that alone was life-changing, like within a week, life-changing. So some of your patients that might appear to be healthy actually need a different type of lifestyle to go after. That it might be that their current lifestyle is not adequate enough. In fact, it's probably not, because they're in pain. So they need some kind of switch. The other thing I get them doing, like I mentioned before, is we get them fasting and we start increasing their good fats. The other really powerful tool that I've used is I help them look at where to use their cortisol. So cortisol for most people is the highest in the morning. So get them walking in the morning so they can use that cortisol so it's not damaging organs. If you are familiar with the Dutch test, we do a lot of Dutch tests in my office, and it'll show you the pattern of where cortisol is being secreted in the body. I've had people where their cortisol is highest at 8 p.m. at night. So I tell them, you want to go work out then. I've had some people where it's 6 o'clock in the morning. Great, go work out then. But the secretion of cortisol is there to make us move. So if we're under stress and we're sitting down all day, what happens is that we're not using that cortisol, and that cortisol can damage joints, it can damage organs, it can make us hold on to weight. So we need to use that cortisol more. So I teach them that as well. So again, multi-therapeutic approach. This is a lifestyle change that's going to need to happen for them, and they're going to need to roll up their sleeves and start working on some of these root causes. So, okay, having said all of that, let me show you what I did for my mom. And again, you can use this exactly the same way. And again, let me know. I'd love to hear how this works for you. So month one, the multi-therapeutic approach for month one is that you're going to start by lowering their carbs. So we got my mom grain-free, and we got her to increase her good fat. So a lot of people need examples of how to increase their good fat. Had her doing scoops of nut butter throughout the day. I had her doing some ghee, avocados, but I really asked her when she was hungry to rely on good fat and not to reach for the gluten-free muffin that she was eating for breakfast every morning. Which leads me to my next step. I asked her to make sure that she was getting 13 to 15 hours where she was fasting, that she wasn't eating anything. Now, for most patients, what this means is you just have them push their breakfast back a couple of hours. The interesting thing with my mom is that she was a night eater. So I literally had to sit down with her, and it was my mom and my dad together. Through this consultation, I said, okay, tell me when you stop eating dinner. And she said, oh, I stop at 8:00 at night. I was like, okay, awesome. You don't eat anything else? And her first reaction was like, no, I don't eat anything else. And then my dad had to jump in and be like, well, don't you remember at 10:00 you have a snack, 11:00 you have a snack? So you might have to explain to them what fasting means. But the first step is to get them doing 13 to 15 hours of fasting. And I want them to experience the benefits of what this can do. The next thing I got her doing was walking 20 minutes a day. Now, she was swimming and she was apprehensive about walking, but I needed her to move. I wanted her to get moving. So she said, well, I don't know if I can do 20. So I was like, start with 5. If you can do 5, start with 5. And then the next day, if you can do 6, do 6. So I had her slowly work up to it, but we want to get joint mobility. The more joint mobility we can get, the better. I learned a really cool exercise from Ben Greenfield. If you're not familiar with he's like a biohacker fitness guy. And you can go look at him online. He had a really interesting exercise where he has people just sit down on the floor and stand back up, and then just sit down and stand back up. And when you first do it, it's actually really difficult to do. But over time, it gets easier and easier. So for my mom, when I mentioned that, she was a little bit, again, apprehensive. So we had her sit in a chair, stand up, sit in a chair, stand up. Do that 20 times a day. When you feel like that's too easy, sit in a lower chair. And then eventually we got her to the ground where she would sit down and stand up on the ground. What that's doing is it's getting that joint mobility and lubrication in the hip joints, in the low back. It's utilizing muscles that you need to functionally live. So that was really helpful too. Then the root causes that we addressed, we had been doing Kyro. I mean, I've been adjusting her for years, but we added in laser to lower her inflammation. She was a big meditator. She meditates every morning. So we use something in my office called a brain tap, which is, as one of my patients likes to say, forced meditation. So it's stimulating the eyes and the ears and using binaural beats to help get the brain into a meditative state. So we worked on that. It improves theta and gamma ray waves in your brain. So it keeps your brain in a very balanced, relaxed place. You can go check them out. It's on my website. If you go to Dr. Mindy Pelz, go under my favorites, you'll see there's a brain tap link there. And a lot of chiropractors are using this. We now have 2 in our clinic. If people are in that nervous system overload place, I really encourage them to go and use the brain tap. Then we got her on the prep phase. The prep phase, I always say, is like crack to me and to a lot of my patients, because it's getting a ton of healthy nutrients to the cell, specifically the mitochondria. So it energizes people. They can have an initial detox reaction, but for the most part, it really gives them some energy. And, for the chronic pain patient, it's depleting. So if I can give them something like prep, where they all of a sudden now have some energy, then all of a sudden they start to feel more hopeful. We gave her L-Gut to help fix the leaky gut. I gave her NZ. It happens to be one of my favorite enzymes to help break down any of the fermented food that was on the side walls. So I know that she hasn't always been eating healthy, so I wanted to give some little things to put in there to really help repair the gut. And then one of the biggest tricks that has worked for us is Rejuvenation toothpaste. And let me explain. So the mouth has a microbiome. And if that microbiome is being destroyed by a toxic toothpaste and not being nurtured by a prebiotic toothpaste, when you go to chew your food isn't getting pre-digested in your mouth. And so it goes to the gut, not pre-digested. And that's going to cause some gut problems. So I switch people over to Rejuvenation, I'm going to say almost all the time. Because if I can't get their mouth microbiome fixed, then I may get stuck with some of the other tools that I use. And then because it was a crisis situation and she was in a tremendous amount of pain, I mega dosed Jot, Kyro, and ARTA for 2 weeks, and I'm to help bring the pain down. Now, what's super cool about what I just showed you is that alone took my mom from a place where she was on a Friday night in the emergency room screaming for pain. It took her from that place to within 2 to 3 weeks, she was living a normal life. She was able to manage the pain. This one protocol on a healthy person. It was, I actually thought she was lying to me after 3 weeks. I was like, really? You're doing that great? And I went to my dad, who will always tell me the truth. And I was like, is she taking, what's her pain medication levels like? With somebody who's chronically addicted to opioids, you actually start counting their medication to see how many they're taking because they lie to you. So I would go into her bathroom and look, and at her pain meds, and I was like, yeah, she's actually doing pretty darn good. So this 1 month was a game changer for her. So please, utilize this with those people that really need that momentary switch, because then, and I showed her, I love this little picture of this woman tenaciously climbing the stairs on the slide I have here, because that's what this is going to look like. It is a journey. And I wanted my mom to know, okay, we did the first step. Now let's go to the next step. So I showed her that little picture. I'm like, this is you. We got the first step. Now we're going to go after the second step. So the second month, what I did is I started to apply what I called more fasting strategies. For her, it was a 6-1 diet variation where I had her doing the keto 6 days a week with the intermittent fasting. And I had her do 1 day a week where she could eat healthy carbs. I wanted to start to train her to do healthy carbs so that she understood that healthy carbs were like quinoa and squashes and potatoes and beans, and they weren't gluten-free treats. I was concerned on month 2 that I might start to see her go back to the gluten-free treats, but I wanted to show her and train her and teach her to do a feast day, but to do it in a healthy way. Then I started to push her fast up a little bit longer. I call it compressed eating, where you're taking the eating window and you're just compressing the time period in which she ate. So instead of eating at 11 o'clock in the morning, I asked her if she could start to eat at like 2 in the afternoon. And she was willing to do that. At this point, fasting was getting a little bit easier. I introduced to her this idea of 1 meal a day, or what the fasting world is calling OMAD. And so it was I asked her if maybe one time a week, could she see herself just eating dinner? I did a video on YouTube called The 7 Types of Fasting. I actually had her go watch it. And I told her that we were going to start to create a fasting lifestyle for her. There is so much good research on fasting and what it can do to downregulate inflammation, that I wanted to start to implant into her brain, that this wasn't like a temporary thing we were doing with this fasting, but that this was actually a lifestyle we were going to start to work on. I had her up to 5 days of walking, which was awesome. We could really get her moving better on the second month. On the nervous system protocols, I moved her over to HQ and N nerve to relax her and get her parasympathetic nervous system balanced. I continued with the chiropractic. I paused the brain tap and the laser. I love switching protocols so the body never gets really stuck in a balanced place. So I wanted to pull those away so that I can put them back in if I needed to. I put her onto the body phase. And then we went after Candida. So I put her on those Candida protocols, or those pathogen purges that I showed you a couple slides ago. So we went after killing Candida. I kept her on the Revitin toothpaste, and then I moved her over to the collagen powder. Now, here's what's really cool about this type of cycling is that when you cycle protocols like this, it tricks the brain. The brain never gets stuck. So I think one of the things I'm seeing with so many people is that they do one protocol and they're like, this is amazing. I'm going to just do this forever. And maybe 3 or 4 months in, they're bored, or the body has come to homeostasis. This is another reason I love systemic, is their supplements are made to cycle so people don't get stuck. But I cycle the whole protocol, so it's interesting, it's new, it's like, oh, what's coming next? It makes that healing journey so enjoyable, or as enjoyable as it can be, and it tricks the brain, and so that the brain doesn't go, this is boring. Do I have to do this my whole life? I don't want to keep doing this. So month 2, I switched some of these things around so that we didn't get attached to any of the protocols, that we kept it spicy and interesting. What we did with her, and I ended up doing it now with all of my patients, is we create a Google Doc where we have a shared document where we write out the protocols, so that if they ever forget, they can go back to that document and they can see what's going on. I also asked her to put on this document how many pain meds she was taking, what her symptoms were. And then every Sunday night, which is when we do family night dinner in my house, she and my dad and myself, we sat down before family night dinner and we just said, okay, where are you on these protocols? So I did have to micromanage her a little bit, partly because she was addicted and she had an addict's mindset. And then the other, because she was my mom, and I was just determined to make this change for her. So this is what month 2 looked like. It was a lot of changing and adding ons. But again, you could follow this protocol exactly how I laid it out. Collagen powder, remember, again, because it has protein in it, please do it outside of their fasting window or it will cause them to break a fast. But it can be really great for hair and nails. It can also be really great for joints. Okay, then month 3, we were at this point, we're humming along. So I moved her into a 5-1-1 variation. I told her this will probably be her lifestyle, where 5 days a week she was going to do keto with intermittent fasting. 1 day a week she was going to do a 24-hour fast with keto, and 1 day a week she could do healthy feasting. So she liked that. That was an easy lifestyle to go into. I chatted with her about fast mimicking and about doing a 3-day water fast. Those are the 2 types of fasts that are great for stem cell production. Now, we talked a lot. This is when I introduced stem cells to her. We talked a lot about, should you go get a stem cell shot? What would that look like? Those are expensive, and my parents didn't have the resources to do that. So we talked about secreting your own stem cells, and could you do a 3-day water fast? She wasn't really sure on that, but she could do fast mimicking. So she's been doing a lot of fast mimicking. Once a month, we have her doing a 5-day fast mimicking plan. And this, everything I'm showing you here, we did almost a year ago with her. And I'm proud to say that she is back to her old self, and that she is 80%, I would say, out of pain. So fast mimicking has also become a resource. I have a Facebook group called The Resetters, and we do a 5-day fast every month. You're more than welcome to send your patients in there, or you come in. It's purely educational. I'm trying to teach people all these different fasts. I also have videos on YouTube you can go look at. I kept her exercising. She was doing it great. We went back at that point. I checked in. I'm like, are you taking too many supplements? She loves taking supplements, so I didn't really have a problem there. But I did put her back on the HQ and N nerve. I did put her back on the laser. We periodically did the brain tap, but I kind of threw everything at it from a nervous system point this month. We moved her to the brain phase, so she's now detoxing toxins out of the brain. We did the second round of the pathogen purging, and then again continued with the Revitin. Now, I introduced at this point muscle rejuvenation because ultimately, after this 3rd month, she had momentum. She was doing so well. So I would check in with your patients and see, are you taking too many supplements? If they're overloaded with supplements, then you would want to let them know that muscle rejuvenation, like 90 days after this protocol, will be phenomenal for restoration of joint tissue that has been damaged from toxic overload, gut imbalance, and a nervous system overload. It's fabulous for that. So, but again, I am dealing with a woman who loves taking supplements. So she was like, bring it on, give it to me. She was willing to take all of this. If not, you can really just introduce it and tell them that would be more of their maintenance supplement. Once this 3 month of addressing root causes, I would move them to 90 days of muscle rejuvenation packs to really keep the momentum going from what you just did. So, but that honestly, these 90 days were life-changing. And it was following this protocol exactly the way I just mapped it out for you that made a difference. And it's so successful for us in our office now that anybody who's got chronic pain goes on this protocol. My staff has it. It's ready to go. They know what to do. And all I've got to do is say, hey, we want to do the chronic pain protocol with this patient. And it's typed out, and they start working the different pieces. So it because it really worked well. And you have to put all the pieces together. It has to be done in that multi-therapeutic approach. So if you're not familiar with some of the pieces like keto or fasting, please educate yourself, because each one of these pieces was crucial for her healing. And the last thing I would say about the chronic pain patient is that, especially if they've been addicted to opioids, and this is really the startling experience that I had here with my mom, is that you need to teach them a new lifestyle. This is not, you don't want to show up, really honestly, you don't want to show up as the hero of the day. You want to give them the power back to believe in their own body. You want to show them that they can stop the pain, they can stop the inflammation by applying these protocols. And why that's so important to the person addicted to painkillers is that they're always looking outside of themselves to solve the problem. And what I really wanted to show my mom was that the solution was within her, that she had all the resources in here to get herself out of pain. And I think it's really important that you teach these people, you don't treat them, you don't show up as this like I'm the hero of the day. And I'm not trying to take any accolades away from you, but know when you're dealing with a person with addiction that they're always looking for an outside in resource. And this is not, they will be, we don't want them addicted to you. We don't want them addicted to the supplements. We don't want them addicted to the diet. We want them to be addicted to their own healing. So teach them, show them how powerful they are. Show them the why behind everything. And I'm going to say one more time that if you're not familiar with these supplements, you have entered a magical world. There is so much good that can happen when you learn how to cycle the systemic formulas, supplements. And the only way you learn, in my opinion, well, there's 3 ways that I see that you can learn these supplements. One is you can talk to practitioners like me. The second is that you can attend these kind of webinars, which is awesome. The third is you can come to the events. This is where so much of the knowledge gets shared. I've been using systemic formulas for 3 years now, and I've never missed one of the intensives that they put on. That's where I learned how to do all of this. That's where I learned how to cycle the supplements. That's how I learned how to teach my patients. So please do one of those 3 things, and know that the more you engage in understanding systemic, the more magic's there, the more incredible results you will get with your patients. So as I always end all of my YouTube videos, from the bottom of my heart, I hope this helps you. Please, if you see me at a seminar, let me know if you tried this protocol on your patients. Let me know how this information resonated with you. I do these webinars to help you and to help you help your patients. One of my absolute, and I probably should have put a slide on here, one of my absolute favorite quotes comes from B.J. Palmer, which is, you never know how far-reaching something you say, do, or think will affect the lives of millions tomorrow. And just by taking the information you learned here, you can have a ripple effect in your community of helping people. So as always, I hope that helps.